Our political leaders signaled their intention to pass comprehensive health care reform by this fall. And of course, now we are seeing House and Senate committees marking up various bills. There have been high-profile meetings at the White House. Various industry groups have pledged to cut costs, which have been soaring well above the rate of inflation. We don't know exactly what the ultimate proposal is going to look like, but legislation has been proposed that establishes a new public insurance plan, requires individuals to own insurance, and mandates that businesses provide insurance for their employees, among other features. Proponents have argued that these steps are absolutely vital in order to save money, improve quality, and provide health care to those who need it. Opponents argue that we should not expand the role of the government in health care, that we should not have public plans competing with private insurance companies, and that the price tag for those proposed changes is way too expensive. Public opinion remains quite complicated on healthcare reform. A recent New York Times CBS national survey found that 61% of Americans believe the rising cost of healthcare represents a very serious threat to our national economy, and 59% believe that the government actually would do a better job than private companies in holding down the costs of healthcare. But at the same time, 77% of Americans have indicated that they are satisfied with the quality of the health care that they personally receive. On top of all this, it's unclear how some of the new advances in health information technology, telemedicine, and mobile health through cell phones relates to the broader effort at healthcare reform. I have a book, Digital Medicine, Healthcare in the Internet Era, and I note that there are many exciting developments taking place in the area of new technology and healthcare. In fact, many argue that new technology actually is the key to long-term cost savings in this area. But we need to figure out how to use technology to reform organizations, change cultures, and alter reimbursement rates, because if we don't get the incentives right, healthcare reform is not going to be successful no matter what ends up in the final package.